Hey, I'm going to introduce our next speaker. This is Dr. Neil Deuchar. He's Director of Mental Health for NHS West Midlands. Neil's had a varied career. He's been dabbled in journalism and media relations. He's been a GP. He's been a consultant psychiatrist. And he's been a director in specialist mental health care in the NHS and obviously at the Strategic Health Authority level. Neil's going to be spending the next 10 minutes or so talking about regional priorities, regional offender health priorities.
Lord Bradley's given a very erudite and comprehensive account of the recommendations arising from his report, and what I wanted to do was to just to light briefly on some of the priorities that we want to see move forward across NHS West Midlands. I'll speak to you from the perspective of being a psychiatrist and having worked in forensic psychiatric settings and in general psychiatric settings and also in prisons, and then as a medical director. One of the main things that I've really kind of learnt over the last 10, 15 years is that when you unpack the word partnership, what you really mean is that you start working with people from other parts of the forest and other parts of the system as a team. And the crucial elements of a team are that all the members of the team share common value, mission, purpose, and from their own expertise and their own training, they bring added value to that team, and together you come to a consensus as to what's best to do about an individual. And when that happens, it's brilliant. When it doesn't happen, as we know too often it doesn't, it's not brilliant. So from my point of view, it's about seeing ourselves as a team. In terms of quality, we've heard about the place of safety. Everyone in the room knows that when you don't get place of safety right, things go horribly wrong. You don't have to have read the Rocky Bennett report, but if you have, it illustrates the enormity of the extent to which things can go wrong. And all of us will have seen at times great practice and at other times poor practice. We've done a lot of work with the police across the West Midlands. We've anticipated the requirement not only to raise awareness and for training, but to do it together, so that we learn how to de-escalate situations together. Another very important aspect to governance in health and social care is learning when things go wrong. We have a certain number of deaths and other extremely serious incidents occurring in custody annually, and it behoves us to look into the antecedents to those events and understand why they occurred, so we can figure out how we can improve services as a result of learning from misfortune and in some cases disaster. The criminal justice mental health teams can have a big role to play in terms of joined upness both at the front door and the back door. We agree with Lord Bradley that part of how we need to achieve that is through joining up commissioning arrangements. To get ahead around managing cases such that the various bits of the system are brought together around an individual in a coordinated fashion. And I think CPA, there's a workshop later on this morning on CPA, has a lot to offer that. Putting aside the historical perceptions of you do that over there and I do this over here, that just can't work anymore. It's not going to work anymore, and we're not going to let it work anymore. And engage in those new ways of working, which hopefully I've given you a flavour of. Thank you very much indeed.